Thank you for joining us. I'm Richard Peretz, and our show today will focus on a matter that should concern us all, that of our health. Many of you are hearing that Medicare is facing insolvency. Our guest today is Bill Faloon, the author of an astonishing new book that exposes how today's broken healthcare system is driving America actually into economic ruin. Some of our politicians want us to raise taxes while others insist on cutting Medicare benefits. Bill Faloon says neither can possibly work when institutionalized corruption is the real cause behind our healthcare costs crisis. Just so you know, Bill Faloon is the founder of the Life Extension Foundation, an organization that was established back in 1980. It is the largest anti-aging medicine group in the world, and I've personally benefited from Bill Faloon's health recommendations. His latest book, Pharmocracy, is perhaps the most important one of all, a real eye-opener. Bill, I've asked you to be on our show today because your book is absolutely astonishing. It is so provocative, and I don't think anyone has pulled together as much hard data on this topic as you have. So the question is, why can't Americans afford healthcare like they used to?
The culprit behind today's healthcare crisis is overregulation. Inefficient and corrupt government policies have caused medical prices to spiral out of control. The travesty is that Medicare faces an unfunded liability of such magnitude that no one knows how to pay for it. Your audience will be shocked to find out that the only reason this nation's sick care system is descending into bankruptcy are inept regulations.
A question on so many people's minds is, how bad is Medicare's financial situation today?
According to the latest report, Medicare's unfunded liability is $24.6 trillion. That means for the government to meet its future Medicare obligations, it should have $24.6 trillion in a trust fund earning interest. But even this gargantuan number is understated as politicians constantly manipulate the numbers. The most recent official report states that Medicare's hospital fund will go bankrupt 5 years sooner than what Medicare's trustees estimated only 1 year ago. The government does not have the money to cover its future Medicare obligations. And Medicaid, which provides health care for lower income people, also has trillions of dollars of unfunded liabilities.
You know, Bill, these amounts are way too gigantic to imagine. The federal government only takes in about $2 trillion each year in total tax revenue. How is it ever going to fund 24 of $37 trillion of Medicare obligations?
It's mathematically impossible for the government to cover its Medicare obligations, let alone Medicaid, veterans, federal employees, and the many other sick care programs it is on the hook for. What no one understands is that healthcare costs are set to skyrocket even further as mediocre new drugs the FDA is approving are costing around $100,000 per patient.
This, of course, is very troubling. Can you give us some examples?
The FDA just approved a drug called Yervoy to treat melanoma that cost $120,000. This drug only extends survival in advanced melanoma patients by 4 months. So for each extra day of life, this drug is costing $1,000. And that's on top of all the other expenses related to treating this lethal cancer. A drug to treat prostate cancer called Provenge is just now making it into the hands of patients, and it will cost $93,000 per patient. Avastin is a mediocre drug the FDA approved to treat breast cancer. It costs most patients around $84,000. The FDA now says this drug does not work for breast cancer and has withdrawn its approval. Some breast cancer patients will pay out of pocket for Avastin because it can relieve metastatic bone pain and it has extended survival in isolated cases. But how many people can afford to pay $84,000?
So, Bill, what do you propose in order to resolve the problem in your new book, Pharmocracy?
The only solution to today's healthcare cost crisis is to repeal draconian laws that have granted a virtual monopoly to the entrenched medical establishment. Unless we restore a free market in the medical field, no one, including government, business, or the individual, will be able to afford the outlandish cost of healthcare. Do you realize how artificially inflated even generic drug prices are, Richard?
I was under the impression that generic drugs saved people a lot of money.
Some generic drugs cost virtually nothing, while others are egregiously overpriced. Take the drug valacyclovir, for example. It's used, by the way, to treat herpes and shingles outbreaks. When it came out as a generic, it cost over $7 a tablet. Some people need to take it daily to prevent herpes outbreaks. That means for this one drug alone, people had to spend $200 a month or $2,400 a year for a drug whose patent expired years ago. Prices of generic drugs fluctuate daily, and prices have come down recently for valacyclovir. But do you know how little it costs to make this drug?
You know, I don't think anyone knows what it really costs to manufacture drugs. What's your thoughts on this?
The cost to make a 1-month supply of valacyclovir is $2.10. Yet up until recently, consumers were being charged over $200 a month for generic valacyclovir. That's a markup of 100 times over the cost of manufacture for a drug that long ago lost its patent status. Life Extension calculated that in a free market environment described in my book Pharmocracy, the price of a month's supply of valacyclovir would plummet to only $6 if it were not for the burdensome FDA regulations that exist over generic drug manufacturing.
This is all really difficult to accept. Can you give us other examples of this kind of price gouging?
Finasteride is another generic drug used to treat benign prostate disease. It cost over $90 for a 1-month supply, which is absurd because, again, the patent expired a long time ago. In the free market approach advocated in Pharmocracy, the price of finasteride would drop to under $10 a month. These obscene profits earned by pharmaceutical companies are being paid for by our Medicare, Medicaid, and private insurance system. We just can't afford it anymore.
Bill, what is the most egregious overpricing of a drug caused by these misguided FDA regulations?
Colchicine is a drug used to treat gout. It's been sold as a low-cost generic since the 19th century. The FDA granted a monopoly to a pharmaceutical company in exchange for them conducting a short-term clinical study. The response was the price of colchicine went from 9 cents a pill to $5 a pill, which is a 50-fold increase. Medicare to Medicaid were paying $1 million a year for colchicine prescriptions, but because of the FDA-created monopoly, Medicare and Medicaid's annual cost has shot up to $50 million each year, and this is just for one artificially overpriced drug.
An obvious question I must ask you is, how is this affecting people's finances, the pocketbooks of Americans?
Employers are paying more than twice as much per employee now compared to year 2001. Employees with insurance coverage have to pay more of their own medical insurance premiums, along with higher deductibles and copays. Employees with health insurance are expected to pay over $4,000 in health insurance premium subsidies and out-of-pocket expenses compared to almost nothing 10 years ago. Those who pay for their own medical insurance coverage have seen their premiums skyrocket. Healthcare costs are expected to double again in the next 10 years. It's clear that Americans cannot afford to pay for today's broken healthcare system. We have to tear down the antiquated regulations.
Considering social responsibility and ethics, what role does Congress have in allowing these extortionist prices for prescription drugs?
Pharmaceutical lobbyists have induced Congress to erect barriers against free market competition. The result is that medical prices are far higher than what they should be. What's most infuriating is that when drug prices shot up to unaffordable levels, pharmaceutical interests wrote legislation called the Medicare Prescription Drug Act, and Congress passed it. This bill mandates that the federal government pay full retail prescription drug prices for people who cannot afford the extortionate cost.
How much will the Medicare Prescription Drug Act cost taxpayers?
Congress was initially told that the Medicare Prescription Drug Act would cost $395 billion. 2 weeks after the bill was enacted into law, Medicare released data showing its true cost to be $534 billion, instead of the $395 billion that Congress was initially told. In sworn testimony before Congress, the higher $534 billion cost was intentionally withheld on orders from a Medicare official who went to work for a high-powered Washington law firm 10 days after the bill was signed into law. The congressman most responsible for passing the Medicare Prescription Drug Act retired to a $2 million a year job with the Pharmaceutical Research and Manufacturers of America. 2 years after the Medicare Prescription Drug Act was passed, the White House projected the cost to be $1.2 trillion, 3 times more than Congress was initially led to believe. So in answer to your question, Richard, Congress makes rules that grant pharmaceutical companies the ability to charge exorbitant prices for prescription medication, often at taxpayer expense. And those who bestow taxpayer dollars to pharmaceutical companies personally benefit after they leave their government positions.
You know, Bill, one might think that with all of this government regulation, we should at least have safer drugs. Is that the case?
Not so. Government regulations cause us to have more dangerous drugs. It costs so much to gain approval that companies engage in criminal acts to protect their obscene profits. Drug companies use their surplus billions to lobby Congress and the FDA to get dangerous drugs approved. And then they keep these dangerous drugs on the market years after their lethal side effects are uncovered. Drug company profits are used to pay doctors all kinds of incentives to prescribe them, even when patients would be better off using lower-cost drugs that have a better track record of safety.
Well, this is really all quite disturbing. Can you give us another example, Bill?
Perhaps the most heinous drug the FDA approved was called Trazolol. It cost $1,000 per injection. Trazolol killed 22,000 Americans after its lethal side effects were uncovered. No criminal charges were ever brought against the maker of Trazolol for intentionally covering up data showing this drug killed Americans. Trazolol was eventually withdrawn from the market because too many Americans were dying. There are dozens of drugs the FDA approved that were later withdrawn because of their lethal side effects.
Bill, over the years you've been harshly critical of the FDA for the past 31 years, in fact. But what actually is the Food and Drug Administration side of that story?
The FDA commissioner was concerned about problems at the FDA and requested an internal report be done to assess the FDA's scientific competence. The commissioner's concern was that this nation was at risk if FDA science is at risk. The FDA's report card on itself revealed the agency suffers from serious scientific deficiencies and is not positioned to meet emerging regulatory responsibilities. In other words, the FDA failed its own report card. In a 60-page report titled FDA Science and Mission at Risk, the FDA admitted its failures across the board.
How does this affect the FDA's ability to evaluate new classes of life-saving medications?
What this report against the FDA means is that the FDA is unable to keep up with scientific breakthroughs that could cumulatively save millions of human lives. So the criticisms that the Life Extension Foundation has leveled against the FDA for over 30 years have been confirmed by the FDA itself. The agency lacks the scientific capability and organizational structure to do its job. And that means millions of Americans suffer and die each year because of the FDA's inability to do what it's supposed to. That is why it is so crucial to deregulate healthcare. FDA overregulation is a big reason why medicine costs so much. Yet the FDA admits it's not capable of doing its own job, so there's no consumer protection being gained. We have this regulated environment, consumers are stuck in it, but we're not getting any benefit.
You mention in your book, Pharmocracy, that Medicare is rife with waste, fraud, and ineptitudes. Can you give us some examples?
Medicare pays tens of billions of dollars in fake claims each year. This occurs when doctors submit bills to Medicare for services never rendered. In some cases, fake clinics are set up that bilk Medicare for tens of millions, then close down and reopen in another location, repeating the same fraud over and over. In some instances, when doctors die, their staff pretends they're still alive and continues billing for services allegedly provided by dead doctors. It is estimated that Medicare is losing 20% of everything it pays out to non-existent or bogus claims.
How else would you say Medicare and Medicaid dollars are being squandered?
It's not only fake billing that is bankrupting Medicare and Medicaid. Congress passes laws that benefit providers of certain medical services so that bonuses are paid if enough expenses per patient are run up. And one egregious example, if a company made 10 at-home visits to a Medicare recipient, then Medicare would pay the provider a $2,200 bonus plus the cost of each at-home visit. This is not a case of fake billing, but an example of how special interests manipulate the Medicare system to cause it to spend much more money than what it should.
You document in your book Pharmocracy that the FDA's delay in approving life-saving drugs is causing millions of Americans to needlessly suffer and die. Please give us an example.